Hi Ruth, I'm Galchan. Nice to meet you. How are you today?
Oh, I'm good. Nice to meet you too.
I'm your nurse today and I'll be helping you to learn about your health condition and living with the symptoms.
Okay, that's great. I would like to know some information about my disease.
Perfect, that's why I'm here. Let's start with you giving me a little bit information about your health and your background of yourself.
Okay, sure. Well, I'm a 56-year-old wife and mom of three kids. My kids are 25, 21, and 17. I work as a security officer at the airport. I have history of smoking and drinking. Unfortunately, my husband passed away 10 years ago of lung cancer, and I'm the sole giver, which is difficult at times. My 17 and 21-year-old are still in school, so they are quite busy, and I don't want to burden them with this responsibility. So my eldest just got a new job as a teacher and is also very busy. So due to the loss of my husband and the stress, I went back smoking and drinking.
I'm sorry for your loss. I can see that you have a lot of responsibility and stress on you.
Thank you. Yes, I do.
And how about in relation to your past health history? Tell me a little bit of that.
Well, I have had a history of fall, smoke, and alcohol consumption.
Okay, and what about your symptoms? What do you usually feel?
I feel sharp pain in my hips, tenderness, restriction of voluntary spinal movement. I'm also starting to notice that my posture is becoming stooped, and I can feel that I can't really perform my activities adequately anymore.
I see. Can you tell me what you usually do to treat these symptoms?
Yes, I use some over-the-counter pain medication for it.
That's good. Just make sure your physician knows about these medications next time you visit him. Let's start off with finding out what is your goal regarding the disease.
Well, I want to know what the disease is since I do not know what it is. But my main goal is I want to learn how to cope with the symptoms of the disease in my daily life.
Sure, I can definitely help you with that. I have a brochure here that can help you follow along as I talk with the visuals. Let's start off with what osteoporosis is. Osteoporosis is a chronic progressive metabolic bone disease characterized by low bone mass and deterioration of bone tissue, which can lead to increased risk of fractures.
I have heard it is more common with women and men.
Yes, you are correct. Osteoporosis is most common with women after menopause. Bone resorption begins earlier in women, and bone mineral density values decrease rapidly as serum estrogen levels decrease. And because women have a lower calcium and vitamin D intake, excessive smoking and alcohol intake can make increased risk factors.
What are the symptoms?
So, the symptoms you are feeling are mostly because of this. The symptoms are silent until weakness in bones increases, such as back, hip bone, and loss of height over time, stoop posture, and the most important, easy fractures.
So how do I prevent this becoming worse? Does diseases have a cure?
So, it does not have a cure, but it can definitely be managed with diet, medications, and exercise changes made in your lifestyle.
So in order for this disease to be managed, I need to make modifications to my lifestyle.
Yes, exactly. For those living with osteoporosis, there are a variety of treatment options available but the primary and goal of the treatment is to prevent or slow down the bone deterioration and reduce the risk of fractures. So let's move on to diet. How's your diet and eating habits?
Well, I don't have any time to cook, so I usually pick up fast foods like McDonald's or pizza before I go home.
Eating too much processed foods and fat foods decrease your nutrient intake, which can worsen the symptoms.
Okay, yes, that is the most challenging for me. How can I make the changes?
No matter what diet you choose, it is always important to have a diet rich in calcium and vitamin D to maintain healthy bones. I also want you to start a food diary and write down everything you eat, the contents, and the time of the day. This will help you to acknowledge what you are eating and how to portion sizes. I also have some measuring cups here that you can take home with you and use to help you measuring the portion sizes.
Okay.
I also have here is some info on a dietitian and the Canada's food guide. They can help you to follow and keep track of what you eat and how much nutrition you need from each food group.
Okay, that's great. Thank you. How much calcium and vitamin do I need? Vitamin D do I need?
Vitamin D is very important. It builds stronger bones. The vitamin D comes from the sun. But in Canada, since we live in a northern climate, we do not get as much as we need. There are some food sources with vitamin D, such as fish, cheese, and egg yolks. You should get about 800 to 2,000 international units daily. Meanwhile, calcium is less absorbed as we age, and intake can be slower and increase bone loss and fractures. Some foods with calcium include spinach, kale, milk, cheese, yogurt, and white beets. You need an equally of 3 servings of milk and alternatives a day for your age group.
So
One serving is also equal to 250 milliliters, which is about a cup of milk.
half a water bottle.
Yeah, just a half a bottle would be enough.
Oh, what if I cannot get enough of calcium and vitamin D from my nutrition?
If you find it difficult to obtain recommended amounts from diet alone, you can take supplements, but you should talk with your physician before you start taking them. Another important information is that you need to stop your smoking and reduce your alcohol intake, because it has been shown that smoking decreases bone mineral density and heavy alcohol consumption decreases kidney impairment, which can decrease calcium absorption. Alcohol consumption for women should be less than 1 cup a day.
Wow, I didn't know this. Thanks for letting me know.
No problem. Do you have any questions so far?
Yeah. The doctor told me something about physical activity. Why is that important?
Yes, that's a huge aspect to manage the disease, as it helps protect your spine and your bones, slows down the rate and loss and builds muscle strength.
Okay. So how much do I need?
It is recommended that you complete at least 30 minutes a day of physical activity. I have a couple videos over here that you could watch later and at home while you complete your tasks, your exercises. But exercises should also include balance exercises, strength training, and posture awareness. You can also go for short walks around the park. Let me just show you some exercises that you can use. For balance exercises, you can easily slowly try to get up from the chair and sit back down. Just do it about 5 times and then give yourself 5-minute interval breaks and continue on with that. Some strength training exercises that you can use is lifting light weights. You can just repeat after me. You can just do this. You can do it 5 times per arm and then rotate arms. Between rotating arms, just give yourself 5-minute breaks or how many breaks you need. And then I also noticed that while you're sitting, you keep your back a little stooped. Just always remember to keep your back straight whenever you're doing exercises or whenever you're sitting doing other chores at home. And when you go for walks around the park at home, just remember to use your hands while you walk like this. Another thing is to make sure that you have appropriate footwear when you walk around and doing your physical activity.
Why is that?
Fall prevention is a priority for patients with osteoporosis because falls are more closely associated with fracture risks. And since you have a bad history of falls, the precaution is needed to be taken.
Oh, okay, that's true. And how about bisphosphonates the doctor prescribed for me?
There are a family of drugs used to treat osteoporosis. They bind to the structure of bones and slow down the action of osteoclasts, which break down bones. They increase bone density and decrease the risk of fractures.
How are they taken and what are the adverse reactions?
Well, they should be taken on an empty stomach, preferably 1 hour before meals or 2 hours after you eat meals, with a full glass of water, and you should be sitting upright while you take these meds. Some adverse reactions include nausea, abdominal pain, loose bowel movements, and there's also a risk of ulcers if you take them incorrectly. But you should also always remember to notify your physician if these symptoms become severe.
Oh, okay. Thank you.
Is there anything else you would like me to help you with?
No, I think I have a good understanding of what I need to know.
Awesome. So was today helpful?
Yes, it was. Now I understand the diseases and can explain it. I know what nutritional changes I need to make, and how much calcium and vitamin D is needed. I know exercise is important for bone strength and need at least 30 minutes a day. I also know that my meds are very important. I need to be taken on time.
That's so good. I'm glad to hear that. Just don't forget to watch the videos I showed and further read the brochures that I gave you.